Good afternoon, everyone. I want to thank you for being here. I'm Mayor Kim Driscoll and appreciate your spending some time to share with us, give us an opportunity to share with you our plans for the remainder of October. I'm joined obviously by Governor Baker. We've had a strong state partnership throughout our planning for October, but most importantly for our planning throughout this pandemic. Grateful to have him here, along with our health agent, Dave Greenbaum, all the way to my right, Acting Chief of Police, Dennis King, and closest to me is Dr. Dave Roberts, the president of North Shore Medical Center. We'd like to ask Dr. Roberts to provide just a brief update as to where things stand with respect to COVID in our community and some of the concerns we have as we move forward.
Thank you, Mayor. So let me just say a word about what's going on in the region and the city today. We're actually in pretty good shape. As of today, we only have 3 patients at North Shore Medical Center who are in-house with COVID. We have been to the hospital with COVID, but it's still in the low single digits, so we're in very good shape in that regard. I'd also would say that we've learned a lot the first go-around on how to take care of these patients, so we're much better at taking care of them now than we were before, and we're in a much better position in terms of having supplies, PPE, in case there is an increase in the numbers. And the only other thing I would say about preparation is I think our nursing homes are much better prepared. I think now that we're much better prepared for that. I do want to just make a plea for what the mayor and the governor is here to say, that avoiding large crowds is a really important thing right now. We don't really want to get into a second surge, and I think the things that we're doing in the city will help prevent that. People say to me who are tired of wearing masks, who are tired of social distancing, you know, do I have to keep doing this? And I say there's 5 reasons why I tell everybody to avoid crowds and to keep wearing their masks. The first is it prevents you from getting sick. Now, I know many people that would come to Salem, but there's 2 issues you need to keep in mind. There's a lot of data that there's a chronic condition after getting infected with COVID. You can be chronically fatigued. You can have trouble with mental acuity. We call that COVID brain fog. And that can affect young people just like anyone else. So think about if you're in college or you're working and 3 months after you come to Salem, you're having trouble getting your work done. That's the price you pay. And we don't know how long that lasts. So the idea that young people are immune to getting sick or having consequences of COVID is simply not true. Second reason you don't want to come to Salem and get the virus, spread the virus, is that you do interact in your daily life with people who are at risk, your mother, your uncle, your grandparents that are over 65 that have other illnesses, and you can infect them. The third reason is if you get COVID and you are wearing 90%, and there's direct correlation to how sick you get by how much virus you get when you get exposed. So if you wear a mask, you keep yourself safe, you keep your relatives safe, and if you get COVID, you make it much. Neighbors and friends that are healthcare workers. Go ask them what it was like in March. It was almost intolerable. And ask them, what can I do to make sure you never have to go through that again? And they will tell you, wear your mask everywhere. So that's my plea to the community. Do it for your neighbors and do it for your relatives. So,
thank you, Dr. Roberts.
Thank you.
So we just want to start by saying a thank you to the residents of our community for their patience, to our business community for their cooperation, and to our city employees who are working hard day in and day out to ensure a safe October, and to the state and our other agencies. Governor Baker, I just mentioned this to you on the way in, like we couldn't be doing what we're doing without a strong partnership. We've had DPH officials, DLS officials, state police, just about every agency is cooperating with us, not just for October, but throughout this pandemic, and we're very grateful. You know, Salem's plans for October have been developed over months. There's been a ton of work that's gone into having a scalable and responsive to whatever is happening during this month. In August, as many of you know, we announced Halloween plans would not take place this year and that haunted happening events would be canceled. And we've taken this pandemic seriously from the start. We were early adopters of mandatory mask compliance, and I'm grateful that we have so many people throughout our city downtown who are wearing masks regularly. In September, we froze our reopening at its current phase, and we did not expand dining capacities or increase allowable gathering sizes, even though we met and continue to meet the public health metrics to be able to do so. We canceled all outside event vendors in October. We've prohibited street performers from the Essex Street pedestrian mall and the surrounding area, and instituted our own local travel reporting requirements so we can hold our visitors accountable who may be coming here. And we long ago suspended paid marketing to advertise haunted happenings. In fact, we are now using paid dollars to advertise and discourage visitors from coming to Salem. Despite all of that, October is still pretty busy. We have less people than we typically see in the October haunted happening Halloween season, but we have more than we feel comfortable having in a historic downtown. Our mask compliance continues to be strong. That in and of itself is in our favor, and to date, contact tracing has not attributed new cases in October to the visitor industry. I also want to commend the work of our small businesses. So far, October's been working well because people are working hard to keep each other safe. And all of this work that's gone in, all of the agency planning, the work on the ground from locals, it doesn't guarantee an outcome. And what we know about October is the last 2 weeks in Salem. The last 2 weeks as we push towards Halloween, we get happens during October. We want to announce a number of measures that will be in effect for the next 2 weekends. And again, typically the last 2 weekends, that's when we have a lot of people coming to Salem, and we're concerned with warm weather and this wanderlust that we're seeing with folks who just want to get out, that we're going to have lots of people flocking to Salem for the typical Halloween events that will not be happening. They've all been canceled. So let me start. I just, again, want to reiterate that while we're announcing these protocols today, they have been in the works for weeks and wouldn't have been possible without a lot of collaboration from a number of agencies. Halloween in Salem, in the best of times, is a complicated, large-scale, multi-agency event that requires an extraordinary amount of coordination and planning, even more so in a year like this year. So I'll start by just sharing with you, we have been communicating again since September. This is not the year to come to Salem. This is not the year to visit. That will continue. As was announced in August, all Halloween activities have been canceled this year. There'll be no music stages, no street performers, no beer gardens, no DJs, and no fireworks, and we hope no crowds. As we undertake each Halloween, fines have been tripled in effect on weekends in October. That means that fines for illegal behavior like public drinking or vandalism or littering are tripled during the last weekend of Halloween. New measures in terms of new restrictions for the last 2 weekends. All city and private garages and lots will close to entering traffic at 2 p.m. on this Friday and at noon on Saturday and Sunday, and again at noon on Friday and Saturday and Sunday of the Halloween holiday weekend. Only downtown residents and those with reserved parking spaces will be allowed to enter. The MBTA garage, which is also located downtown, will reduce its hours for non-commuter parking. So we're not going to allow people access in after noon on weekends, 2 p.m. on this Friday. Cars that park on street, we do know that when we restrict parking, it tends to put people into the neighborhoods where we have resident parking zones. Cars will be ticketed and towed. We have additional enforcements of public safety teams coming up to ticket and tow folks parking in neighborhoods if you don't have a valid resident parking hashtag. The MBTA commuter rail trains. We are normally the busiest commuter rail train stop in the MBTA system. Trains on the weekends outbound from Boston will not stop at the Salem station on October 23rd and October 30th between 7 and 11:30 p.m. So Friday nights after commuter hours, no trains will be stopping in Salem. Will be a pass-through station. And then on the weekends, the 24th, the 25th, and the 31st, we will not have trains during the day. 11 a.m. to 11 p.m., we're going to be a pass-through station. I want to explain how different this is. Normally, we are imploring the MBTA for more trains in October. I think this is a complete opposite approach for us to try and limit visitors coming up. This Saturday, October 24th, we're asking all of our businesses in the downtown area to curtail activities by 8 p.m. The weekend before Halloween is traditionally what we call Halloween Junior. Lots of people in town. We need to make sure we don't allow the street party to get started, and we're working with our business community to curtail activities after 8 p.m. That means we're not going to allow lines to be permitted in the public way after that time. For Halloween weekend, that's Friday and Saturday, the Board of Health will be working to put in place a mandatory closure as of 8 p.m., again, to limit crowds from gathering, anticipating the normal Halloween activities that will not be happening. City streets will be closed to through traffic and potentially to pedestrians at any point during the day. Our public safety teams are well versed in trying to keep people safe. We want folks to know traffic patterns can change, and we'll be directing people out of Salem, especially given the fact that parking garages and lots will be closed. We'll have 15 traffic control points between noon and 8 p.m. on the 24th, the 30th, and the 31st to manage closings as necessary on the ground. Those who know how we typically run Halloween night are familiar with the closing push that usually takes place around 11 p.m. as police and public works crews move visitors to depart for the night from restaurants and other attractions that are happening. That will take place this year again at 8 p.m. It's our hope that there will not be people in Salem to push out, and that will not require us to undertake that measure, but we are prepared to do so, knowing that we want to limit any bit of stationary activity or congestion. I want to really express how unusual, and abnormal it is for me to stand up and tell people not to come to Salem in October. We normally welcome throngs of visitors from around the globe to our community. And our residents are typically wonderful ambassadors of that. This is just not the year, and we really want to send the message that if you're coming to Salem, come in November. Save it for next year if you are intent on being here for haunted happenings or Halloween. We want to do everything that we can to keep everybody safe, including our residents who are here, the visitors who are coming, the numerous employees who work in our downtown businesses, and that's why this plan is being deployed at present. And again, I want to thank the governor and his team. None of this could have been possible without action, willingness, and an understanding that we want to keep everybody safe, and that takes a team effort. And I'm grateful to be able to introduce Governor Baker now.
Thank you, Mayor, and it's good to see you, Dr. Roberts, as well. How many people here have been in Salem on either Halloween Junior or Halloween weekend? So if you haven't been here, I think it's really hard to appreciate why the mayor and her team feel so strongly about how important it is to limit the size of the crowd. We don't live that far from here. When our kids were little, we used to come over during the day. Our kids, when they got older, came over at night. And how many people?
On a Saturday, you can have 50, 60,000 easily throughout the day.
So a Gillette Stadium's worth of people would be in Salem's downtown. So when you think about just all the issues around close contact, the mall, that mall area is literally shoulder to shoulder from one end to the other. If you expect to get from one end to the other in less than 10 or 15 minutes, it's not that long a walk, you won't be able to do it. And people, generally speaking, are either in costume, and the costumes are pretty creative, or jazzed by the opportunity to see so many other people who are there in costume. And that doesn't even count the street performers or the concerts or any of the other activity. It is a festival. And it basically starts on October 1st, and it basically lasts until Halloween. And at this particular time, given all we're dealing with associated with COVID, and the fact that it is the fall, and it's a period of time in which all the public health people have said you can expect to see an increase in cases as people move indoors, it's critically important for people to take the mayor's guidance on this seriously. You do have exceptional mask compliance. I mean, our family's been over here a few times in September and October during the day, on the weekends, and at night. And it's 90% plus. And it's manageable with respect to the distancing that's possible in what I would call a traditionally busy day in downtown Salem. But a typical Halloween weekend in Salem is not manageable with respect to the issues that the mayor and her team are talking about today. So I'm going to talk a little bit about what the state's going to do to support the mayor and the folks here in Salem, but I do want to give a quick update on COVID. Yesterday, the Department of Public Health issued its daily report and indicated over 17,000 new individuals were tested by molecular tests, and there were reported 821 new cases. In total, about 2.5 million people have been tested, and the state has conducted about 5.3 million tests. The 7-day average for positive test rate is 1.3%. There are around 500 people that either have COVID or are persons under investigation for COVID. But if you talk to the hospitals about how many they really believe they have in-house that have COVID, that number is probably somewhere between 250 and 300. The suspected metric was one we developed before a lot of the hospitals were much more sophisticated about testing generally for COVID, and it's one of the elements of the dashboard that we think, in consultation with the hospitals, we probably need to update as we go forward. We pay a tremendous amount of attention to the number of COVID patients in hospitals for all the reasons that Dr. Roberts talked about. It's a key measure with respect to our healthcare system's ability to serve people who do get sick. As the mayor said, and as Dr. Roberts said, vigilance is critical here. Many people in formal settings, in work settings, when they go shopping, when they go for a walk in their own downtown or somebody else's, wear face coverings, maintain distance, use hand sanitizer, do all the things that all the folks in the public health community encourage them and recommend they do. But that vigilance needs to stay present when you're with groups of people you know, the same way it is when you're with groups of people you don't know. And that, in many respects, especially as people move indoors, will be one of the biggest challenges we all face in the fall. And if you look at our data generally, the increase, the vast majority of the increase in positive cases over the course of the past 4 weeks has been in that population between the ages of 19 and 39, many of whom get together with their friends and with others in informal settings, without distancing, without wearing masks. And it's really important that they recognize two things. Number one, just because they're less likely to get sick doesn't mean they're immune. That's point number one. There are, in fact, many people in that age group who do get hospitalized and get very sick. And the second is many of them may be carriers who are asymptomatic and have the significant potential of passing this along to people who are older, people who have comorbidities, or people who are just naturally more susceptible to the virus than they are, which is why distancing and masks are so important. We're supporting a variety of communities around many issues associated with COVID, especially in high-risk communities. But we think about Salem, at least when it comes to Halloween, for different reasons, as a high-risk community. And it has a lot more to do with crowds and foot traffic and close contacts and a lot of out-of-towners who come to visit than it has to do with the more traditional way we think about high risk. As the mayor mentioned, she and her team have been working this one hard all the way through the fall, and we're enormously grateful for the leadership that she's brought to this issue from the beginning with respect to managing COVID. The command center's been working with Salem to post signage, distribute multilingual materials, reminding residents about the steps that they need to take to keep themselves and their families safe. And this includes Halloween-themed materials that are customized for Salem, but the message remains the same. Wear a face covering, avoid gatherings, and maintain distance. And on the enforcement side, our COVID enforcement and intervention teams have been working with local officials here in Salem, as the mayor said, the ABCC, the DPL, state police, and others. Since we launched the Community Enforcement and Intervention Team, state agencies have completed over 150 inspections just in Salem and north of 5,000 across the Commonwealth. And we're going to continue to work with Salem, especially as we head into the final couple of weeks here before Halloween. And we'll continue to partner with local officials to complete the inspections and, if necessary, take the enforcement action that might be required. And as is in the case in other communities that are higher risk, the state police will continue to coordinate with local police on additional support, including expanding patrols if necessary, and working with the local PD here over the next couple of weeks, if they're needed, to deal with some of the issues around crowds. On the transportation side, we're basically going to support the mayor's request with respect to public transportation. We have message boards up. I drove by several on my way up here about the fact that there are no Halloween events in Salem this year. The boards are on Route 128, in Beverly, in Peabody, and in many other parts of our highways in eastern Massachusetts. The MBTA is making targeted commuter rail schedule adjustments on Fridays and on the weekends, and we're making those adjustments, as the mayor said, with the goal of discouraging people from just taking the train up to Salem and walking around. But we do want to make sure that essential workers and others who rely on the commuter rail will still have access to the train. So over the next 2 weeks, the T will make the following schedule changes for outbound trains originating from North Station. On Friday evenings, meaning October 23rd and October 30, all rush hour trains will run, as will the last 2 scheduled trains of the evening. But the remaining 8 evening trains after the rush hour won't stop in Salem, which is the 7:30 to 11 time frame that the mayor spoke about. On the weekends, both on Saturday and Sunday of this weekend and next Saturday on Halloween, the first 2 trains in the morning and the last train in the evening will still run, but the remaining 10 trains on those days will not stop in Salem. Inbound trains from Salem to Boston will not be affected by these schedule adjustments, and the MBTA garage will have restricted access for transit users only. Travelers can visit mbta.com to see the adjusted schedule, and the T will communicate the schedule changes with riders throughout the next couple of weeks. These adjustments will obviously help the city minimize crowds during the busiest part of the Halloween season, while ensuring access for those who rely on the commuter rail for work and other functions. As the mayor said, ordinarily, there's no better place to celebrate Halloween than Salem. These are not ordinary times. As we've said for months, the administration will continue to work with communities here in the Commonwealth, and especially with Salem, particularly because of what typically happens in the last couple weeks of October, to help them manage crowd size and minimize the possibility of COVID transmission during this time. I also want to remind residents and local officials in all of our communities that the Department of Public Health has issued tips and guidance for Halloween, and that includes avoiding indoor events. I can't stress this one enough. I mean, every time I talk about this issue, I get emails and text messages from friends of mine that have screenshots of indoor house parties that their kids and they have been invited to. This is a really bad idea. I can't express this enough. Indoor house parties, close contact, shared food, shared beverage, long periods of time with the same people, some of whom you know probably pretty well, but don't know where they've been or who they work with or where they've traveled, without masks or distancing, which in most cases will be the case, are just simply not a good idea. On the other hand, outdoor trick-or-treating done with small groups, face coverings, and limited interaction between the kids who are making the rounds and the families who are providing treats on a nice cold night in October is actually a lot safer. And I just want to close by saying I got a great letter from a 9-year-old. It was written with a crayon, but it was quite clear. It said, "Governor Baker, I want to thank you for not canceling Halloween. And I think the best thing you can do to make sure that people really limit their exposure to each other when they're out is to tell everybody that they should give out one large candy bar instead of those baskets of many small candy bars, because then kids won't put their hands in and fish around for them."
No fun size. No fun size.
No fun size, which I thought was a pretty clever way of promoting an idea in the context of all the rest of this. And with that, I'll turn it back over to the mayor.
Thank you, Governor. Appreciate you being here and all your support throughout this. We're happy to take questions. Again, I want to make sure you know we have our acting police chief here, our health agent, Dave Greenbaum, if there are any Q&A at this point.
Any idea how much of a financial hit businesses will be taking?
Yeah, I mean, I think that our businesses have had a pretty good month so far. The restrictions on occupancy have been a limiter, but there will be limitations on those later closures, 8 p.m. In talking with our business community, I've talked with several of them. I think they understand this. We're in it for the long haul. It's not just about October. It's about November, December, and January. We don't want to do anything now that's going to push us into a phase that we'd have to shut down completely.
Some are talking about maybe defying the 8 o'clock closure. What tools do you have in your toolbox to make sure that businesses do shut down?
Yeah, I hope not. We do have an active Board of Health that is going to be having a meeting this evening. Most of the businesses that I've spoken to understand their predicament and are grateful for the partnership. They're working hard to keep their employees safe, the patrons that are coming in, and our residents. And we certainly have the authority of the Board of Health, if we need to act. I'm hoping that we're not going to have to push people into a corner and that they're willing to cooperate with us.
Understanding that money isn't everything, but can you give us a number of what you normally would bring in for the Halloween season as a town?
Yeah, it's hard to break it down into 1 month. I can tell you right now, the first quarter of fiscal year 21, our hotel motel tax revenues for our community are down 55%. Our meals tax revenues are down 35%. We'll obviously tracking that as we go through the year. This is typically a big month. It's going to be there's reduced capacity, so we're going to see reductions there. But again, it's about more than October. Salem will be here after Halloween, and we want to make sure we're up and running and serving everybody well afterwards as well.
How does enforcement change for crowds that will be there lingering on pedestrian all past 8 p.m. when this is closed?
Yeah, Chief King, do you want to take that?
Thank you. So the preparation for this Halloween started November 1st, 2019. And so to say that our preparation has had to change and be dynamic is an understatement. This entire time, we have had to rely on resources and partners that we traditionally rely on, but in different ways. And they've all been great, from the state police to our NEMLEC partners, to the MBTA, to the governor's office. So we have experience when it comes to moving crowds out of Salem. That's been developed over well over a decade of handling and managing crowds. And so we have approaches that rely on compliance and the ability to perhaps block streets and the like. What we will have to do is for sure take into consideration de-densification when we do push a crowd. And so those are the things that we will be doing, but we have all the resources available to do that.
Because the two numbers you're talking about are an apple and an orange, okay? One has to do with the number of tests that were positive, that were reported on a particular day. The other is the number of tests that were actually done on that day, on the day in which the report comes out. The numbers with respect to actual test positivity are the ones that come off of the chart that's several pages into there, which gives you the actual positives over the actual number of tests on each day. I don't know if you remember this, but back when we first put this whole thing out, one of the confusions that was created early on was we were literally just reporting what we had every day, right, for information. But as we started to create a dashboard that had a history on it, people would say, well, you know, it's Friday now, but on Monday you said you reported this number of tests. Well, but those were the number of tests that we reported on where we had results. That wasn't the number of tests that were actually done on that day. And the positives on that day are on that chart in the back, not on the one in the front. So one of the things we're going to try and do here is make the whole thing a little easier for people to read and understand, given that we now have 2.5 million people, a third of our population, who've had at least one test, and in many cases have had more than one, because they've traveled or they've had close contacts more than one time and felt they needed to get a second test. And 5 million, over 5 million tests overall. It's the same thing with the hospitals around the suspecteds versus the actuals. I was on a call this morning with the hospitals where they basically said, yeah, back then we definitely were carrying a lot of suspecteds because our testing infrastructure was nowhere near as sophisticated as it is now. And one of the guys actually said to me, we have employees who've said to us, that testing, that number you have for total patients who are with COVID in our hospital is actually like twice what we think it actually is. What's the difference? And the answer is back then, there were a lot of suspecteds that might have turned into being actual positives. But at this point in time, these guys have made so much progress with respect to the way they actually process tests, tee people up before they come into the hospital in the first place, that the people under investigation is really small. And they're just a bunch of these things where the world has changed with respect to our ability to provide information, our ability to collect information, our ability to deliver on our testing, tracing, and care delivery agenda. And we just want to make sure that we update our maps and our guidance and our dashboards to accurately reflect the way a lot of this stuff is working now.
So are you saying then that the number we're looking at, the number of tests on the dashboard, is the number that have been reported in, but over a larger number? In other words, the number of positives is actually from
It's just not calibrated to the same day. I mean, we're trying to get to the point where tests on a day, tests processed on a day, same, right? Same day, with all the positives and all the tests on the same day, and that's where the 7-day rolling average comes from.
Okay, so in other words, the number of positives is not necessarily coming out of that.
The denominator in some cases is different.
Do you know when this dashboard will be?
I'm hoping it'll be out by the end of next week.
Kevin, I know you live in Salem, but your message to people, just to be clear, for this next 2 weeks is stay away, or what's the message?
I think the message for the most part, yes, is stay away. Unless you have a restaurant, a reservation at a restaurant or something like that. If you're just going to come to wander around, I should let the mayor answer this question. Pardon me?
You're not coming to Salem the next 2 weeks.
I will not be coming to Salem for the next 2 weeks. I'm going to take the mayor's word for it and behave appropriately. But I've been to Salem in September and in October, and I've been really impressed with the way they've handled a lot of the issues around masks and distancing, and the restaurants and the stores have done a terrific job of complying with the rules and the guidance that the states put out and that the cities put out. And I do think, if you think about a typical Halloween, Junior, and weekend here, I mean, having been here and having seen the size of the crowds, it would be really hard to deal with almost any issue associated with distance and close contact. Did you want to?
Can you give us the guidance for other cities and towns on trick or treating?
Yeah.
Is it based on?
Why don't you let her?
Okay.
Let the mayor answer the first question.
Yeah, I think you did a pretty good job of it. Our goal is not to have any more people in town these next 2 weekends. There are people who have reservations. We know there are people coming. As much as we're amplifying this message, Salem will not be a ghost town on Halloween. But we certainly don't need we certainly don't need more people coming here, especially the number of visitors this year who just aren't planning. Literally just, you know, we're going to drive down from New York for the weekend. And that's the sort of things we want to discourage. It's not going to be a good experience for you. It's going to be too crowded for us, and we want to do everything we can to prevent that from happening.
Can you speak to the number of people who do that, who don't look at your website and don't know that you guys don't have all the stuff?
Yeah.
That normally...
You know, we probably never need to advertise haunted happenings again, because there's a lot of people here, you know, during a current virus without a lot of advertising going on. But when there's good weather, you know, we had the Adam Sandler movie drop all about Salem. It puts Salem in the forefront. And we're known for having an amazing fall festival and lots of activities for people to do. And folks don't know necessarily that everything's canceled. So you would talk to hoteliers, frankly, at the earlier part of the week, and they'd maybe be half full, lesser numbers. By Thursday or Friday, they're 85% full, right, for weekends. So people are coming up. The weekends are the issue. Midweek, not so much. And that's where we really want to discourage just the day trippers, the college kids who come up on those trains and just drop thousands at one time, because Halloween and Salem kind of go together. That's what we need to avoid these last 2 weeks in particular. We've done a pretty good job managing out throughout these first 3 weeks, or first 3 weekends, I should say. We've got 2 more to go, and we don't want to blow it now. We want to keep everybody safe. Our businesses have been allowed to operate within the guidelines, and now we want to make sure there's not a COVID spike in our community or in the Commonwealth as a result of what typically happens here the last 2 weekends, which are big crowds when there's warm weather in particular.
Mayor Driscoll, I have a question. Can you speak to how unprecedented some of these measures are? I mean, like over the 16 years that you've been mayor, have you ever had to implement anything like this, or had a situation where you had to shut down businesses early?
Yeah, I'll say I really feel like the fun police here, right? It's the cats are biting the dogs sorts of scenarios. We are never saying, we are normally imploring people to take the trains and working with the MBTA to get more trains here. We are normally working to accommodate parking, make sure people know where to park and how to park. So the activities we're taking, really telling folks, this isn't the year to come, put it off until another time period, and certainly do not come without a plan at all, is unprecedented for us. And I think it speaks to the times we're in. It's just not safe to be in our historic city with nooks and crannies and the sorts of physical distancing not being possible.
Mayor, can I say something?
Yeah, please stay.
Thank you. I want to take advantage of being able to educate the public with all you folks here. So what percent, if 30, 40,000 people showed up at Salem on the weekend, what percentage of them do you think have already been exposed to the virus and are, for want of a better word, immune to the disease? What percentage of those 30,000 in this state right now have pre-existing antibodies to COVID, do you think? So the answer is 10%. So that means 90% of people that show up at Salem are susceptible to the virus. 90%. I'm just trying to dispel falsehoods. And so what percentage of the population needs to be positive before this issue of herd immunity actually can kick in? That's controversial, but it's probably 60%. So the point I want to make is the vast majority of people in our state have not been exposed to the virus and are at risk of getting it. So just remember that every time you are around anybody, that they're highly likely they've not had the virus and they're at risk of getting it, which is why we can never lose vigilance until we get a vaccine, because we're never going to get that number high enough to prevent widespread death until we get a vaccine if we don't keep doing the things we're supposed to do. It's a really important number. I think that's the most important number to remember. 90% of people you see every day are at risk of getting the virus. Thanks.
Governor, Halloween sort of morphs into Thanksgiving season. Lots of folks are trying to make plans now. Do we invite all the relatives for Thanksgiving? Should people be thinking about that right now? Maybe thinking about scaling back?
So we've been talking to the public health folks about guidance for Thanksgiving, and we'll probably have some things to offer in a few days. I think the one thing I would say is this might be a good year, and this will be a very unpopular thing to say, this might be a good year not to travel, right? If to get back to the doctor's point, one of the things that create spread is a whole bunch of people who are in one place where they may be safe and not affected by this, traveling to another place and vice versa. And the Wednesday, I think we all know this, the Wednesday before Thanksgiving is usually the busiest travel day of the year. And people want to go home and they want to see their families, and I completely get that and understand it. But I think it's really important for people to remember that almost every state in the country has some degree of guidance associated with travel, and there's a reason for that, because travel shows up quite a bit in a lot of the contact tracing activity that people do. And I think this is an important issue, and I get the fact that people are making plans, and we'll probably have more to say from the public health folks in the next few days. But the biggest thing I would start with is this whole issue of travel. So we have a daily download from the courts with respect to what's going on there. The first thing I'd point out is the courts have said for a long time that they have roughly 10,000 cases that predate COVID, that predate March 10th, that predate the emergency order. And that's where they are starting. And many of those cases require them to send a notice out to actually find out if it is a case, if it's still a case. So for them, a big part of the next few weeks is going to be about dealing with cases that predate the emergency order and the pandemic. Any landlord who wants to pursue a case is going to have to file a notice to quit to begin with. That's a 14-day turnaround from the courts, and the tenant is permitted an opportunity to submit interrogatories, which usually adds at least another 2 or 3 weeks to the process. The resources associated with our RAF program and some of the other initiatives we're putting in place with the courts will be there to serve people who are associated with the post-emergency order time period. But the most important thing I would say to everybody is the primary focus of the courts, at least for the next few weeks, maybe even the next month to 6 weeks, are going to be the folks who were in the docket, in the queue, before there was an emergency order and a pandemic.
And that daily download,
Say again?
that daily download that you mentioned, is that how your administration plans to track those filings and proceedings?
We have a whole series of stats and stuff that's going back and forth between the courts and our administration to make sure we keep score on all this stuff.
What's the guidelines for cities and towns about trick-or-treating? Is it individual towns deciding, or?
There's a lot of available information on the DPH website. My overarching message is indoors bad, outdoors good. And if you're going to be outdoors, it's best to travel in a small group with people you either know really well or live with, and everybody should wear a mask, not just like a Superman mask, or a Wonder Woman mask, but like a real mask, like the one you're wearing. And if you're going to be if you're going to lay it out on a cookie sheet and let kids come up and just take something off your front porch, that's one way to do it. If you have any interest in actually putting stuff in kids' trick-or-treat bags, you definitely ought to wear a mask, and you ought to make sure that that interaction is outdoors and really quick.
And a lot of people seem to have COVID fatigue. Do you have COVID fatigue?
Well, I certainly, I was thinking about this the other day. If you listen to some of the conversations and some of the dialogue and some of the back and forth that was taking place back in March, a lot of people were expecting that, maybe sometime in April, certainly by June, we'd be past all this. And that just speaks to some extent to how much we had to learn collectively as a society about this virus back at the beginning. I don't have COVID fatigue. And I don't believe most people in Massachusetts do either. You know, I do go out with my wife, Lauren, and we do walk around a lot of the downtowns just to see what's going on. And people are wearing masks. People are distancing. People are doing the things we want them to do to stay safe. I think everybody would love it if this wasn't something that they had to get up every day and think about and deal with. But I've also run into people who said things to me like, I've spent more time with my family than I can remember. I've had a lot of people say, you know, I used to travel 2 or 3 days a week. I used to travel 8 or 10 days a month. I don't do that anymore. And as a result of that, I spend a lot more time with the people I love and care about most. There are some, you know, sort of silver linings in all this. And I think one of the things that has always been true of people in this part of the world is we go through big changes in weather. We go through big changes in seasons. We go through a lot of ups and downs for a whole bunch of reasons. And people basically suck it up, and for the most part, they play the hand. And I've been incredibly impressed with the way people in Massachusetts have played this hand. And the one thing I would say is what the mayor is up to here, and what a lot of the work that was done by so many to put us in a position where instead of doing 2,000 or 3,000 tests a day, we're doing 60,000 tests a day, or to put us in a position where we have a contact tracing program that can hit every single person who tests positive and follow up with their close contacts, or to be in a position where, you know, we have a healthcare community, Dr. Roberts said this in his remarks, where people aren't worried about PPE, which was a huge issue earlier in the year, and a long-term care community that's far better positioned than it was previously. People have done a lot of things to basically play this hand, and they continue to do it, and in my opinion, continue to do it pretty well. What's going on in Salem is a great example of people basically acknowledging the facts as they are and acting accordingly.
The president said we rounded the corner. Are you saying we rounded the corner?
I think most of the guidance that I hear from the public health folks around here and the epidemiologists around here and the medical professionals around here and many of the ones too that are at Johns Hopkins and other institutions that study this stuff is that the fall is going to be a lot more difficult than the summer for all the obvious reasons. But that said, I do believe we are in a much better position to deal with this issue now because we are doing so much more testing and tracing, and because we aren't worrying about PPE, and because our long-term care community is in much better shape than it was last spring to work our way through this. But as far as I'm concerned, until there are vaccines or treatments that, you know, are very effective, I still think we're, you know, sort of flat out straight ahead. I don't think about it as rounding a corner, no.
There was a report yesterday that you're being considered for a cabinet position in Joe Biden's campaign. Have you talked with anyone there? Any comment on it?
I haven't, no, I haven't talked to anybody. And as I said yesterday, the Lieutenant Governor, Karen Polito, and I, during our campaign in 2018, said that if we were fortunate enough to be elected, we would serve out our term. And you know, this is a job that I enjoy, and I love the people of the Commonwealth, and I'm grateful to have this opportunity. It humbles the bejesus out of me on a pretty regular basis, but I think you're stuck with me for the next couple of years.